Have you ever been to the doctor after an injury or some joint pain and your doctor has said rest and elevate? And you've left the office thinking, well, how do I do that? Why do I do that? And what exactly does that mean? If you've ever had that question, then stay tuned because I would love to tell you the how, what, and why of resting and elevating. Welcome to InjuryGuru.com. I'm Carla Schimmelpfennig, registered physical therapist, and you are tuning into the area in the website where I answer common questions. And the common question I have for this week is, my doctor recommended rest and elevation. What exactly does that mean? That is a great question, a question that I have gotten lots of times over my 25 years, and I have found that what my patient views as rest and elevation is really often quite different than my version of rest and elevation. So I'd just love to give you some information, some good information, so that you can be clear exactly what does that mean when your doctor says rest and elevate. When your doctor tells you to rest, he first and foremost means rest from the activity that caused your injury or pain. And secondly, he means now he wants you to rest from any activity that causes more pain or seems to irritate your now injured body part. Whether that means little to no walking after an ankle sprain, or no bending or prolonged standing and walking after pulling your back. Sometimes it may even mean complete bed rest to get over a particular injury. And if you have done this bed rest as you have been recommended, and it's been 3 or 4 days, and there's not, it really hasn't taken care of the pain and swelling, then make sure you give your doctor a call because there's probably something else that needs to be looked at. So let's talk about this elevation part, or this elevation aspect. Elevation may need to be used along with this rest, especially depending on what you have injured. So if it's an injury to an ankle or a knee or a wrist or a hand or elbow, then swelling and pain often come together. And to combat that swelling, this rest as well as elevating will decrease that pain, keep that pain under control, will decrease the swelling, and help speed up this whole healing process. In order to properly elevate a leg, so let's say you've injured your ankle or your knee, in order to properly elevate that, your leg has to be higher than your body or higher than your heart. And what I find with patients, a lot of times they'll just be reclined in a recliner thinking that they're elevating the leg, but in reality their head and chest, so the heart, is not lower than the leg. And if it's not lower than the leg, then it won't be near as effective as what it should be. So what I tell my patients is they need to use 2 to 3 pillows under that leg. So here's 2 fluffy pillows, and you could even add a 3rd pillow. When you put your leg or rest your leg up on these pillows, again, making sure that your head and your chest are laying flat on the couch or bed or your floor. Now you can put a pillow under your head just for comfort, but you want to have those pillows under your leg lengthwise so that they're covering most of the length of your leg, and you want to make sure that your ankle and foot are up on that pillow all the way. Otherwise, you might get a bend in the knee, and again, it's just not as effective. If you have had an injury to the wrist or hand or elbow, same thing goes for that when it comes to elevating. I want you to make sure that you're always lying flat. You can use a pillow under your head just for comfort. And then you would want to place those pillows beside your body so that you can rest that entire arm, including the hand, on those pillows, so 2 to 3 pillows. You can also elevate the arm in sitting. So you can sit in a chair next to a table like this, rest your arm up on that table, and then put a few 2 or 3 pillows under that arm, just again to make sure that the arm, so whether it's the elbow, the wrist, or the hand, is higher than the heart. So that's a quick, good description of what resting and elevating mean. And the best thing that you can take from all of this is that if you have had an injury, you have some pain, some swelling and bruising, just know that rest and elevation are the biggest keys to getting this healing process going and getting you back to doing those things that you need to do.